my name is Jessica Nelson, and today I'm going to be demonstrating how to do a head-to-toe assessment. So to begin, today we're going to be doing a head-to-toe assessment. So today we're going to be auscultating, inspecting, percussing, and palpating head to toe. Okay, so to begin, just so you know, I'm going to be talking to you and to the camera so that others may learn from this experience.
Okay.
Okay, all right. So to begin with the patient, what you're wanting to do is get their vitals. So with their vitals, I always start with a pulse, and I count that for a minute. And as you're getting the pulse, what you can also be doing is inspecting the skin. So inspecting the skin for any lesions. Trent is Caucasian, so noting if there is any redness, blotching, bruising, noting the skin. Temperature is warm. Noting the turgor. Noting if there's any edema. And also you can look at the face and noting if there's any masses, lesions, and you can also palpate the scalp. Trent, is there any tenderness?
Nope.
Okay, so palpating for any masses, looking for any lesions, noting the hair, noting the texture, if it's really thin, if it's too thick, or also noting the distribution of the hair throughout, noting if there's any bald patches throughout. And as you're doing this, now that it's been a minute for the pulse, you can also start counting the respirations. Now, I hold my hand right here just because I act like I'm doing the pulse for 2 minutes. But what I'm really doing is the respirations. I'm counting the respirations. And this is because when you're talking to a patient, you tell them that you're going to count their respirations. Sometimes they'll start breathing faster or more shallow, more deep. It just changes the rate of their respirations as well sometimes. So I just won't even let them know that I'm doing this. So for example, Trent's respirations are unlabored. I'm noting the depth, that they're not too deep, that they're medium, they're not shallow. And then at this time, it is the 2-minute mark. And so noting that his pulse was 76 and his respirations were 16. While you're here, you can also have Trent. Can I have you squeeze my fingers as tight as you can? Great job. Noting the strength is 5. Noting the radial pulse. Noting that they're 4+, and you can also do the pedal pulses after the radial. And you're wanting to compare one to another, and you're looking at also like the cap refill, comparing one side to the other, but also from upper and lower extremities, that the cap refill time was 3 seconds. So moving on to looking at the face. So we talked about, noting for edema, noting the varicosities. What you're gonna do next is actually, we'll keep doing the vital signs. So we'll do the temperature and the blood pressure. So Trent, I'm gonna put this in your mouth, under your tongue. And then we're gonna get blood pressure. So I'm just gonna have you relax your arm right there. And the temperature was 98.5. and his blood pressure was 128 over 78. And you can get a manual, but you can also check for it with machine as well. At this point, if you were in the hospital setting, you would also check for the oxygen saturation with a pulse oximeter. So moving on to looking at the face. So with the face, we're going to start with the eyes. So we're going to first look at the pupils. We're noting on the perla. So pupils are equal, round, and reactive to light. And you're going to look at the pupil and you're noting when you shine a light in their eyes that this side is constricting as you shine a light into it. But as you shine a light into this eye, this other eye should also be constricting. Same when you do this side. And you're noting the pupil trends compared to this is a 5. And then you're also noting the sclera color, noting if there's any lesions, any redness, and Trent sclera is white. You're also noting the conjunctiva. So pulling down, noting that they're pink. And then while we're here, we can also do the oral mucosa. So if you can open your mouth. Can you say ah? So you're looking at the tongue, looking for any lesions, looking at the gums, noting if there's any gingivitis. Can I have you lift up your tongue to the roof of the mouth, noting under the tongue as well? Looking at the teeth, noting if there's any breaking. Then we're going to check into the nose. So if I can have you lift up your nose. So as you're looking in the nose, you're looking for any edema, noting the discharge, noting if there is redness, any lesions. Inside the mucosa is pink. And then while you're here, you can note the lymph nodes, the submandibular lymph nodes. Is there any pain right here?
Nope.
And the cervical lymph nodes. Is there any pain right there?
Nope.
Okay. And then you can do the sinuses. So the frontal sinuses, is there any pain?
No.
And the maxillary?
No.
Okay. And then you can also palpate the thyroid. Is there any pain right here?
Nope.
And you can come behind. Is there any pain?
No.
Okay. All right. And then if you had an ophthalmoscope, you could look more closely at inside the eye, and with your otoscope, you could look into the ear and note, look at the tympanic membranes in the ear canal. So next we're going to check for hearing acuity. Hearing acuity, you can either do the whisper test or you can rub your fingers together and know if they hear that.
Mm-hmm. Yes.
Okay. And then you can also do the Weber and the Rhine test. So the Weber test, you're going to have your bell and you're going to strike it and you're going to put it in the middle of their forehead. And you're going to ask which ear they can hear it out of.
Both.
They should be able to hear out of both ears. If for some reason they can't, this could indicate hearing loss. Next is the Rhine, which you again strike it and you put the middle over the mandible bone and then put it right in front of their ear.
Yep. Yes.
And they should be able to hear on both sides with that vibration. So with this, you can also do like a visual test with like the like a handheld chart or a Snellen chart, or what we do in the hospital setting is we just stand back and we can have them tell us how many fingers we're holding up.
3, 5, 4.
Great. All right. Moving on to respirations. So you're looking at the thorax. You're first noting the size of the thorax and the shape and the movement. We already talked about the depth of the respirations and how his respirations were unlabored. You can also do a measurement for the size. So you can measure from side to side and then also front to back and compare it. Noting if the thorax is concave or if they have a barrel chest. And then you can palpate for excursion and symmetry. So Trent, tell me if there's any pain. You're also looking for masses, lesions.
Nope.
Okay. And Trent, can I have you take a deep breath? Noting that the lungs come, they come out, back in, and you'll compare like front to posterior. And then you can do percussion. So percussing, you can go down and you're noting when it goes from dull to tympanic. And this indicates where the lungs end. And then you can have the patient take a deep breath and hold it. And then you can release. And noting how when the patient takes a deep breath, how that dullness enlarges, and that's how much that lung can hold. And then we're gonna auscultate both front and back for the lung sounds. So first, we're gonna listen with the bell or with the diaphragm. So as Trent's taking breaths, deep breaths in and out, we're listening for any crackles. We're listening for any bronchi sounds. Comparing side to side. Can I have you lift up your arm a little bit? Okay. And then while we're here, we can inspect the chest also for heaves, lifts, moving on to the cardiovascular assessment, and we can palpate the PMI, which is the midclavicular line and fifth intercostal space down. And we can note the amplitude as 3+, and this is where you're also doing like your radial, your pedal pulses that we did earlier and how they were 3+. Next, we also checked for like the capillary refill of the extremities, but we can also check the Hohmann sign for a DVT. So this is where I'll have you lift up your leg, Trent, and then you'll grab the calf and you'll dorsiflex their foot and ask if there's any pain.
Nope.
Okay. And you're always wanting, again, to compare side to side.
Nope.
Okay. So if there was any pain, this could be an indication for a DVT. But we're gonna auscultate your heart sounds, Trent, starting with the diaphragm. And we're listening for the rate and the rhythm and the quality. Checking for any bruits or murmurs. Moving to the bell. While we're here, we can do the musculoskeletal as well and the neuro. So Trent, can you tell me your name?
Yes, it's Trent Nelson.
Can you tell me where you are?
Bluffdale, Utah.
Can you tell me the time?
Roughly 4:30.
And can you tell me what we're doing here?
We're doing a head-to-toe assessment.
Awesome. Okay, so as we're moving on to the musculoskeletal, we're going to first check for the strength of the arms and the shoulders. So I'm going to have you push up, Trent, and have you move your palm down and push down. And again, comparing side to side. And moving your arm up, moving it down, okay. Moving it up, moving it down, and then side to and down, moving up and down, and then checking your wrists. So push up, push down, push up, push down, and then your legs. So push up, and then pushing down, and then your leg, push up, push down, push up, pushing down, and then checking ankles. Push up, push down, push up, push down. All right, and that would be a 5+ strength. So then moving on to the range of motion. With the range of motion, you're going to palpate and see if there's any tenderness or if there's any masses. Is there any tenderness or pain? Okay, so I'm going to have you move up. And at this time, you're listening for and palpating for any crepitus, any popping. Okay, this side. Noting if there's any clicking. And is there any pain or tenderness?
Nope.
Okay. All right. And then what we can also do is we can check for scoliosis. So noting the posture, noting that Trent's posture is relaxed and that he isn't like slumped over or stiff. So Trent, what I'm going to have you do is I'm going to have you stand up. And I'm going to have you face this wall. And I'm going to have you touch your toes. So looking at the patient's spine, you're noting the curvature. You're noting if there's any curves. You're also looking at the hips. You can note when you like stand in front of the patient, you can note if the hips are like one is up or down more than the other. And then Trent, I'm going to have you stand up. We're going to check for CBA tenderness, which could be indication for a kidney infection if there is any tenderness. But you take the spine right here and you take the 12th rib and then it creates that angle. And what you're going to do is you're going to percuss. Is there any tenderness? No? Again, you have this angle right here. Is there any tenderness?
Nope.
Okay. And then we can also check for gait. So Trent, I'm going to have you walk to the wall and back. Okay. And as you're noting the gait, you're noting if there's any limping or if they're leaning side to side, if there's any like stiffness. And then you can also check for the Romberg test. So Trent, what I'm going to do is I'm going to have you close your eyes and you note to see if the patient starts to sway at all. No. Okay. All right, Trent. Next, we're going to move on. I'm going to have you actually sit back down. And we're going to do your reflexes really quick. So you can check the patellar reflexes, which is under the knee. which when you go under the patella, the leg should kick up. And then if you do the Achilles, it should make the foot kick up. Which his reflexes did work. So then, Trent, what I'm going to have you do is I'm going to have you lay down and we're going to do the gastrointestinal. So with this gastrointestinal, what you're looking for is you're first inspecting, right? You always want to first inspect. And what you're doing is, before I forget, you can, while they're laying down, you can also check for the hip range of motion. So Trent, can you lift your leg up and down, noting if there's any popping, crepitus, and you're wanting to compare side to side? Okay. No. All right. So going back to the gastrointestinal assessment. So first, you're indicating like the appearance. Are they overweight? Are they obese? Is there a potential for underweight, or is there a potential for any eating disorders or malnutrition? So you're looking at the abdomen, you're noting the size, the shape, if it's distended, you're noting if there's any bruising or if there's hernias that you can see, and then you're going to palpate. So Trent, tell me if there's any pain. And you're palpating each quadrant.
No.
Okay. You're noting if there's any lesions as well. And while you're here, you can also palpate the bladder. Trent, is there any pain?
Nope.
No. Okay. And then you're going to percuss. So you can percuss each quadrant. So for example, in the right upper quadrant, there's the liver, and you'll notice the dullness as you percuss compared to the other quadrants where there's more of a tympanic, like over the stomach. And you can also percuss the bladder, noting dullness, and then as you go up, that more tympanic sound, and that tells you how full the bladder is. While we're here, we can look at the McBurney's point, and we can push down, and then as you release, you know if there's any pain with the patient. If there is, this could indicate appendicitis. So next we're going to listen. You're going to note, you're going to assess for bowel sounds, first with the diaphragm, in all 4 quadrants. Noting if they're hypoactive or hyperactive, or if there's just a normal amount. And moving on to the bell, noting if there's any bruits. Okay. All right, and at this point, that concludes the head to toe. Thank you guys so much.